So today we have Dr. K.P. Damayanthie Fernando. I welcome today's speaker, Dr. Damayanthie, and I'll just introduce, as I know Damayanthie since many years. So Dr. K.P. Damayanthie Fernando is a Sri Lankan national who completed her BMS degree from Gulab Purba Ayurveda College, Jamnagar in 2006, topping her batch, and she was granted a full scholarship for post-graduation at I.T.R.A. Jamnagar. She holds an MD in Panchakarma from 2011. She completed a post-graduation diploma in yoga and naturopathy, that is PGDYN, in 2008 from the Patanjali Institute for Yoga and Naturopathic Teaching and Research. And also in 2011, she joined the Barbarian Ayurveda Resorts Hospital, a pioneer in medical tourism in Sri Lanka, as a consultant, physician, and a researcher for Ayurveda, where patients from various parts of the whole world, mainly Europe, USA, England, Japan, Australia, Middle Eastern countries, etc., seek Ayurveda treatment. From 2015, she joined Sidram Ayurveda Private Limited, affiliated to Ayurveda College, UK, as a visiting lecturer. She participates as a judge in yoga competition at Ashtanga Yoga Mandir, Colombo, Fort, affiliated to the S. Vyasa Yoga University, India. Dr. Damayanthie had been an active participant in various national as well as international conferences held in Sri Lanka from 2012 and had presented many papers and has published publications to her credit. She has worked in Germany, Hong Kong to promote Ayurveda. Currently, she is part of a group of Ayurvedic physicians managing the Ashram Center for Ayurveda and Ashram Ayurveda Resorts for providing authentic Ayurveda care and yoga therapy for local as well as overseas patients. She deals with lifestyle disorders like hypertension, dyslipidemia, etc., fertility treatments, gynecological conditions, and especially regenerative spine related. She conducts yoga sessions for healthy children as well as children having special needs, etc., autism, ADHD, milestone delayed, etc. She is passionate about spreading the authentic knowledge, research in finding better and newer scientific methodology in treatment as well as understanding ancient knowledge with contemporary tools and data. So, without deliver her lecture on art of practicing Panchakarma in Sri Lanka. As she is postgraduate from I.T.R.A. from in Panchakarma and she is practicing Panchakarma in Sri Lanka, this lecture will be useful for our students and those who have joined online, that how the Panchakarma is being practiced in Sri Lanka. So over to you, Dr. Damayanthie.
Thank you very much, madam. I hope I'm audible and clear. So today I intend to speak about practicing Panchakarma in Sri Lanka. As madam told about myself, all the details, I would not go into detail about my studies at Jamnagar. I directly start with the Dhanvantari Vandana. रागादिरोगान् शततानुशक्तान् अशेषकाय प्रसितान् अशेषान् औत्सुक्यमोहारतितान् जगानान् यो पूर्ववैद्याय नमोऽस्तु तस्मै. And also I bow down to all my guru. I bow down to Lord Dhanvantari as well as all my guru, including Rajkala madam, who was my senior. I am very much humbled and very pleased to be here today as part of today's session. Please go to the next slide. I intend to speak about these points, a little bit of history and and the practices of practicing Ayurveda in Sri Lanka, and how we practice Panchakarma, and the clinical analysis process and the challenges that we meet. And my specialized topic was Vasti. I'm very concerned about speaking Vasti because Rajkala Madam is a pioneer in practicing Vasti, that I know. But I try to give few points about Vasti. So Sri Lanka and India had been very much connected culturally, spiritually, being very near countries. So our um, history is written in Mahavansha and Cholavansha, where the documented history of Sri Lanka is written in script of Sanskrit and Pali. So, what we have heard is through the history that Ayurveda has been learned by kings or the prince who are to become king. So Ayurveda has always been having the royal patronage. That means the kings were learning Ayurveda and practicing it for their own health as well. There are kings who have written textbooks in Ayurveda in Sri Lanka, which
Dr. Damayanthie, sorry to interrupt.
is
Can you switch off the other speaker which is there near your phone? Other speaker. This one, another speaker is on. Yeah, yeah. Now it is working. Okay, go on.
Is it okay, madam?
Yes.
Okay. So these kings, because they have learned about Ayurveda, they have sometimes written even textbooks of Ayurveda. We have such textbooks in Sri Lanka still available and written in Sanskrit. The one such textbook is Sarartha Sangraha, and we have something that Sarartha Sangraha mentions even the Pashu Ayurveda. And we have a textbook which is named as the Vatika Prakarana, which tells about the how to prepare medicines. And then there has been invasions always that has led to a little bit of downfall of practicing Ayurveda. But I'm very sure you all know about King Ashoka. He was known as Chanda Ashoka, and then after seeing the Buddhism, he has become Dharma Ashoka. The Dharma Chakra that is on the Indian flag, which is a replica of his sign, and it seems his son brought Buddhism along with Ayurveda and other affiliated knowledge to Sri Lanka, which led to revival of Sri Lanka around 3,000 years back. Please, the next slide. And then we have still the relics of hospitals in Ayurveda, and there has been, these are called as swastika, and then also it is called as Arogi Shala. And these there had been separate Sutikagara. Sutikagara, as you understand, it is for the pregnant mothers to come and give birth. So such places are still available if you ever visit Sri Lanka. There is an area called as Mihintale and Anuradhapura. So these are the areas where the kings have developed such places. I have tried to capture few of the images of those places. As we go along, these are the names of the kings that you see on the slides, and few more images of how a patient would be immersed in oil in a such a stone built platform. And then coming to the next slide, we have another temple, another hospital relics in Mihintale area. If I don't mention the name of King Ravana, my history part would be incomplete. So I know in India, Ramayana being an epic, the name of King Ravana is so bad that when I was studying in Jamnagar, my friends used to tell me never to go out on Dashera day. So I was very worried. But when I came back to the country, I started researching on King Ravana, and we still find these textbooks written by him. That is, one is Arka Prakasha, one is Nadi Prakasha. Arka Prakasha was about creating over 680 types of Arka. And then Nadi Prakasha is about pulse diagnosis. And then Kumara Tantra is how to take care of a child from birth till death. He has described. And Sinduram is the just like the Sindur a lady would apply. These are the red color medicines, rasa medicines. So this is referring to the Kupi Paparasayana. So these all the textbooks along with Ravana Samhita, which is a powerful textbooks of Hindu astrology, is still available. And it seems that this Dasa Shirsha was referring to 10 types of sciences he has mastered. And it is a well-known factor even in different forms of Ramayana. It is said that he is a Shiva Bhakta. So that is how he got the boon of immortality, and he has been practicing a lot of Rasa Tantra. That is why even when I came first to Jamnagar, people used to ask me, is the Sonike Lanka still there? And at first I was confused because I did not know much about King Ravana. But when I started studying, that it seems he was a good Ayurvedic Vaidya, and we find this reference of his grandfather as the Pulasti Rishi who came to the Rishi Sammelana. So that name I found. So coming back to the today's scenario, let's go to the next slide. So today we have Ayurveda, Unani, Siddha medicine and homeopathy, and something called as Deshiya Chikitsa in our alternative medicine or the indigenous medicine system. So you will see that even though today is the International Day of Yoga, we don't recognize still yoga as a treatment system. In Ayush system, you will see that Ayush stands for yoga as well. Even though we enthusiastically participate in yoga activities and we practice yoga, yoga is not recognized under the indigenous ministry as a medical system. So coming to the scenario of the practice in Ayurveda, we have government-funded Western medical hospitals, and similarly we have government-supported Ayurveda medical hospitals, and then there are private medical hospitals, just like what is available in India, and then there are Ayurvedic hospitals which are private, and there are resorts. And then there is a set of traditional medicine practitioners. This does not come under any hospital. And we have special, these traditional medical practitioners are there from generation to generation. They have specific recipes with them and ingredients that are unique to them. So such therapies are for Vrana and Vitridi. That is one. And then there is for Devum Pilisum. Devum Pilisum is for the burns and disfigurement management of burns, and then there is something for the Bhagna and the fracture and dislocation management, and then there is something for the Visha Chikitsa. Even now, if I get bitten by any kind of reptile or a snake, I would rather go to these traditional practitioners than to a hospital. So that much faith is there. But let's go to the next slide. But still, just like in India and world over, the modern medicine has taken the higher hand or the upper hand in practice of medicine. That is why I prefer to call Ayurveda in Sri Lanka as the forgotten part of medicine, because we have forgotten half of that traditional knowledge. As for the dietetics, the practice of home remedies, all that is forgotten. So if you look at the university scenario, in Sri Lanka, we have two main universities which practice or teach Ayurveda. That is, one is the Gampaha Vikramarachi University of Indigenous Medicine. This is very recent, only 4 or 5 years back this was established. And the oldest institute is the Faculty of Indigenous Medicine or Institute of Indigenous Medicine in Colombo. And then we have a recent development of complementary and alternative medicine in the Rajarata University. This is in the ancient city of Anuradhapura. And then Jaffna, until recently we had a civil war in Jaffna, and Jaffna University has the Siddha medicine faculty. So these are the 4 faculties of Ayurveda that are in Sri Lanka. The upper 2 faculties mainly teach Ayurveda. So coming to the next slide, these are the common disease conditions that we treat about. I mean, very common to what is practiced in India and patients who come for the treatment of Ayurveda. Uh, the the next slide also is about the diseases. From we find a lot of non-communicable lifestyle-related diseases, patients seeking Ayurveda care, and also I personally try to introduce a lot of Navajata Shishu Paricharya and the Bala Chikitsa to parents, because a lot of parents tend to give a lot of antibiotics and stuff to the children. To prevent that, I try to tell them how to take care of a child Ayurvedic way. And then next, I'm going to touch upon the clinical approach that is happening in Sri Lanka, because as Ayurveda physicians, no new patient comes to us. Usually, it is after trying everything, a patient would come to us when let us try Ayurveda as a last resort. That is how we get the patients. So, as Rajkala Madam said, there are many students today present. I would like to really stress upon the clinical methods or clinical approach, because you would face the same. And if you go to work in another country even, you should try to keep in mind these points, like the how to get the present symptoms. So it is very difficult. Some people have even forgotten their current symptoms because they have been suffering from the disease. They come to us for 15 or 20 years. So then they don't remember how the disease started, and they don't remember what are the other disease conditions they suffered from in between. And then it becomes, when they have been having the disease for 15-20 years, even the lower back pain, they come to us after 10 or 15 years sometimes. Very rarely we get a new patient telling that I have low back pain since 1 week or 4-5 days. So then what happens with other diseases, our diagnosis as per Ayurveda becomes very complicated. And then I always try to take this BPTPR, we call it as blood pressure, temperature, a pulse, and respiratory rate. Other than the blood pressure and all that, if you leave aside, the most important thing here is to calm down the patient enough for me to guess their pulse. So I try to take the Prakriti and Vikruti through the pulse, depending on how calm and what condition they are in. Like for example, when a patient takes an appointment with us, we usually tell them to come without breakfast or a very light breakfast. So usually the consultation time is given approximately 2 hours after that their breakfast time, and then I try to check pulse so that I can get as much as information I can from the pulse. And then once we take the pulse, and then approximately if you can guess the person's prakriti, then if you like, what I do is I ask few extra questions to confirm my sort of decision about the prakriti, and they become very amazed, as if I am a fortune teller. Like I can guess about their whole life. That kind of amazement comes to them when they are, like for example, if I ask them, do you easily get angry? They are like, how did you know? Because these are the things people try to hide. Like you don't want anybody to know that you are a pitta prakriti, because you might lose temper very easily. So if you ask such a question, you might instantly gain faith of the patient. So then the next convincing part becomes much easier for the therapies. And then, of course, the family history in a disease condition, when it is non-communicable or lifestyle-related diseases, are important for us to handle. And then the newest condition that we face is the vaccination. Because of the COVID, after post-vaccination, we find a lot of health threats, lot of health complications, especially heart-related complications in the people, and sudden heart attacks, sudden strokes. These are the things which we face. So I always try to get the whether the person is vaccinated or not, and how many booster doses they have taken. So this has a direct effect on their health complications. So try not to forget that. And then even though I don't get to do Dashavida Pariksha between the first consultation, because usually our first consultation is about 30 minutes. Not longer than that. Within that 30 minutes, I must be mentally prepared to capture the maximum information. So then what I ask them is about appetite, bowel, urine and sleep. These four factors I ask to capture the most of the Dashavida Pariksha, because when they are describing these things, I can even get an idea about sattva, whether it is good sattva or not. Even that I can get an idea. And you would realize that some people don't even know what their appetite is like, and some people don't even know what they have eaten for breakfast. So you have to be very careful and very tricky in obtaining that information from the patient, because some patient, due to age, they don't remember what they have taken in the past week, whether they have taken Vatavardhaka food. That you have to decide, but you have to know what they have taken. So when people don't know whether they have good appetite or not, what I try to do is ask them, how much of food can you take for breakfast? What do you take? So depending on that, I can decide whether the person has Pravara, Madhyama or Avara type of appetite. And then the same way for the sleep. People don't know how to describe their sleep. So we have to ask indirect questions to achieve or archive that information from the patient. And then another thing that has cropped up or come up in the past few years is allergies. When I started being in the hospital OPD and all, we did not worry so much about allergies. And nowadays, when I'm practicing, I am very careful about allergies, because, for example, we have one oil which is called as Sarshapadi Thailam. Sarshapadi Thailam, just like the Niragiri Thailam, contains the turpentine oil along with the mustard oil. So Sarshapadi Thailam, I think it is a Sri Lankan product. It is a pain relieving type of oil, very strong. So if I don't ask about allergies, and then if the patient says they are allergic to seafood and the pineapple, then I would not use Sarshapadi Thailam, because in clinical practice, what happens is, if such a person is hypersensitive and pittaja, and then if I use Sarshapadi Thailam, invariably they will come up with an allergic reaction, and hives like burning sensation on the skin, blisters, that sort of thing comes up. So allergies is a very important thing. And the addictions. Again, I have found that if there is nicotine in blood, our kashaya does not act equally potently, and the nicotine is more strong. So gradually decrease in the things, because I can tell you one patient detail, because since this is the evidence that we have. I had a patient, a male patient, who had high amount of platelet count, and even after removing a certain amount of blood by the modern medicine, it was not coming to a controllable level. So they were predicting that it is very bad situation, almost going towards a blood related cancer. And then when this patient came to me, I gave a very strict diet plan, and then we did 3 virechana with the a gap of 3 months. And you would not believe, the whole platelet count came back to normal. Okay, but then this person was addicted to meat. So meat is freely available in Sri Lanka. And then the patient came back to me. He thought he got cured. I said, no, you will have to follow your diet plan of not eating meat at least for a few years, for your body to adjust the immunity, because the platelet count otherwise might again go up. He said, life without meat is not useful for me. So he went back to eating meat. and then there was blood transfusion and the blood removal. Then what happened? Within 1 year, he passed away. So that is the effect. I mean, I could see the effect of Panchakarma, the Virechana, very clearly. Platelet count came immediately back to normal with that. But then since the how do you say, the paricharya, the paschat karma, the what he had to follow, he could not follow, and he did not wanted to follow, so he had to end his life. So this is how powerful the treatment is for us, and I have like tremendous faith in the panchakarma, the shodhana. But then after that, the patient should be sattvavan enough to follow the diet and follow the changes, lifestyle changes that are required. And then you have to definitely ask about the exercise and the physical activity, because why I say this, when I was working in Germany, I realized that Germans are addicted to exercise, and we Asians, we definitely come on the yoga side. We, our patients, like in Sri Lanka, and I'm sure in India, when you try to tell them that you need physical exercise, they almost get very worried and scared. So they say, how much exercise do I need? So if I tell a patient to walk for 30 minutes, they get very worried and they said, we don't have time. So then I have to repeatedly tell them that you have to find time. On the other hand, when I look at the Western Europe scenario, most of the time in the West, they go for a walk or bicycle ride after each meal. So this is again going towards Ati Yoga. So you will have to watch this very carefully with your patients, not to make it Ati Yoga, where again it would go for the Vata Prakopa or Ayoga. So both has to be kept in mind. And I come to the most important 2 points that I want to stress upon. Since you are studying at the university and you have this chance to learn about the investigations, sometimes you will see, and I'm sure you are seeing, patients with big files of investigative reports. Sometimes it takes me a lot of time to go through each one of them because the patient wants me to. And half of it is not relevant even to the disease. So while you are studying and while you have amazing teachers like Rajkala Madam, please make sure that you know each disease. Please read the modern disease review as well, and then try to learn what are the most necessary investigations needed, and try to know the how do you say, reference points, and what is the normal range of that investigation. Like for example, if you take a full blood count, this is very easy thing I'm telling you. Full blood count, you should know. If you take the neutrophils, basophils, try to remember the normal range. Hemoglobin, what is the normal range for a kid? What is the normal range for a female, male? And then if you are able to read X-ray or MRI, that is very, very convincing for the patient. And then the next thing is, the patients come with, as I told you, trying everything else. So they come with a very huge Western medical prescription. Like sometimes they come as long as 15 drugs on their prescription. So when it comes to becoming successful in Ayurveda practice, it is very important to taper down unnecessary medication. Okay, I'm sure in India it is allowed, in Sri Lanka it is allowed, and some patients they do it without informing the other doctor. But when you are talking about these prescriptions, current medication of a patient, you need to know the pharmacology well. Then only, like for example, when there are beta blockers, then only you can taper it down. And then there are a lot of medicines, even though we say Ayurveda is herbal and very safe, there are a lot of interactions of certain medications, certain fruits even, that can change the whole scenario of your therapy. For example, if the patient is on clopidogrel or aspirin or even heparin, if you give Chitrakadivati, that can have an interaction. We call it as a drug interaction, where one herb can affect the other chemical medicine. The same way, if you look into the the country profile, in Sri Lanka, it is very common to have chronic kidney disease. This is not because of the medicines. It is because of overuse of fertilizer and pesticides in our crops. But then people have this fear that if we take Ayurveda medicines, it can also lead to kidney failure. So our first biggest challenge is to explain to them that no, Ayurvedic medicine given in the proper dose for a proper duration will never create kidney disease. But at the same time, continuation of modern medicine for a long time, like hypertensive medicine, can create such kidney disease. So that is what we have to explain to the patients, that our medicines are much safer. And please, shall we go to the next slide? So in practicing Ayurveda, those are the challenges that we face. I'm sure you also, if you one day start practicing on your own, you will face all these problems. That is why I thought of mentioning them. And when it comes to Shodhana or Shamana, many people don't understand even these words in Sri Lanka. Even though we have a close relationship and word meaning of this Shodhana and Shamana in our own language, they ask us what it is. So we have to give a very detailed description. And for example, my research therapy was Vasti. So Vasti, most of the people think it is just given a soap water enema. And when I say no, we mix a lot of herbs together, and this is what we try to do, they are quite puzzled. And some are not even believing that such amount of change in their life can be made through a simple Vasti. So that is why what do we practice? So Shodhana wise, I try to explain to them by first giving the Shamana, the effect of Ayurveda. Then after, I convince them very slowly for doing the Shodhana. This is the normal protocol that goes in Sri Lanka, because initially, as I tell you, they have forgotten the traditional knowledge. And then these are the therapies that we do. Please, shall we go to the next slide? So when we are giving the Panchakarma or Shodhana therapies, when we start Deepana Pachana, we do it at an OPD setting. That means the patient will take home the medicines and take them. So the most challenging thing is monitoring the patient. And then even the Snehapana, they do it and go home. So once they go home, what they are eating, even though we give them a good food list, it is very difficult to monitor them. So then a lot of, we say, lot of in the sense, in some people who are not following, we find complications. And then Ayurveda is not recognized for the health care insurance, medical insurance. Now it is a big victory, I feel, in Sri Lanka, that we can give a medical certificate for few days of leave from work. Otherwise, medical insurance, that it is not paid for through insurance. Only the Western medicine is paid for. So then when I explain the Panchakarma, even the terminology, benefits, and the essentiality of doing the Shodhana for not letting recurrence to happen, then people get the problem of how do I take leave? How many days of leave do I need? So we have to be very careful in telling them exact number of days and to avoid the complications. And then the other thing about practicing Panchakarma is the cost of treatment. The Shamana medicines, once you give them, they know that these are the things that are given to you. Okay, this is the cost. But when it comes to the Panchakarma, when I'm going to give a Vasti, they only see the liquid and they don't know what is in there. So then they ask, why is it so expensive? So then we have to explain all the ingredients that goes into the Vasti and say that even the catheter, the syringe, everything, you have to account into the cost of the treatment. So Panchakarma becomes more costly. And then when we get patients from abroad, we have to give them very specific time duration of the Panchakarma that we are doing. Even local patients, for the number of leave they need, there we have to be very specific about the practice of Panchakarma. So I try to do authentic Panchakarma because in Sri Lanka, as I told you, there is a new concept which is called as spa. In the spa, you can get a whatever you want. Like if you want a Shirodhara, just one Shirodhara. If you want a Sarvangadhara, just one Sarvangadhara. So that is at the spa setting. It's a very new setting which is ruining the Panchakarma in Sri Lanka, and which I don't at all recommend or not at all think that it should be done. So whenever somebody comes to me and asks, can I get a Abhyanga? After checking the pulse and the consultation, I say, yes, you can get one Abhyanga. If somebody asks me, can I do a Shirodhara? Then I say, no. No, you cannot do just one Shirodhara. You need to be assessed. You need to be assessed for how many number of days you need Shirodhara. But before that, you need a Shodhana, different type of Shodhana. And we have to pace out or keep a gap between your Shirodhara and the Shodhana. So all that I explain. So this makes a difference, and I try to make a difference. So that is the scenery of practicing Ayurveda and Panchakarma in Sri Lanka. Anywhere else in the world, I think these are the common challenges that we face as the people who are actually trying to practice authentic Panchakarma. So coming to the next, this is the point where I don't want to touch too deeply because my one of my seniors, one of my teachers is very carefully listening. That is Rajkala Madam. I still remember Rajkala Madam as one of her students told. She was very punctual at the OPD when we were studying. And she was one who was telling us also, always try to give the vasti yourself. And we always try to do that, even though we are very tired. And the one thing I have seen about Rajkala Madam is she's never tired. So any number of vasti, any number of treatment she would be able to do. So coming to vasti, Madam has done vasti also her PhD study. I still remember that it was about microalbuminuria related to the diabetes. So I still remember that. And then coming to the Vasti, I chose Yapana Vasti. As you all know, as students of Panchakarma, Vasti is said to be Ardha Chikitsa or Purna Chikitsa because it's cures Shakagata, Koshtagata, Marmagata, all the Anga Avayava is covered in Vasti depending on which ingredients that you add. So that is why it is said to be cure for the Vatika, Sansargaja and Sannipataka conditions of all the Tridosha. And when you are explaining the Vasti, you have to always make a point of how the enteric nervous system, the ENS, has a profuse effect and a connection with the central nervous system, because that is one condition. When I try to give Vasti for Parkinson's, when I try to give Vasti for Pakshagata, many of the people ask me, you are giving an enema through the anal route. How does it affect my brain? So it takes a long discussion with the patient and convincing the patient how the ENS and CNS are very well connected. And I don't practice much Vamana, but I practice a lot of Virechana. But even Vasti is better than the Virechana because it can do the function of Virechana, and it can do the function of many other things, and there are not many complications and not many the Paschat Karma, the Peyadi Sansarjana Karma, we don't have to worry so much. So please, shall we go to the next slide? So Yapana Basti was what I chose for my condition. This is I added simply because of the vast nature of the Basti, the classification. There are so many classifications as per the procedure, as per the Adhisthana, Dosha, as per the disease, and then as per the nature of the person as well as the Vasti, and depending on the main ingredients and the dosage. And then please, next slide please. Coming to the special types of Vasti. Next slide, please. Yes. So Yapana Vasti, which I have chosen as my research topic, that I would touch upon. It is a type of Madhutailika Vasti. So it is a very nourishing vasti, and there are other names, Yuktaratara vasti and the uh, Siddhavasti type of thing. And then there are other Lekana vasti, Vaitarana vasti. You have to carefully check the patient and carefully check the what you call the sattva or the fearlessness of the patient, because some patients get very scared when we enter the, even though it is not pain, they constrict the sphincter, and then sometimes the vasti does not, we cannot do the vasti properly. And when we are giving the vasti, one of my teachers, I.T.R.A sir was there. I.T.R.A sir used to tell us, you have to uh, take care of yourself when you are doing a therapy for the patient, especially in Panchakarma. For example, this was in Vasti. He was telling us all the time, tell the patient to open mouth and breathe, not to sneeze, not to uh, uh, cough, and not to yawn. Otherwise, you will get the Vasti, not the patient. So that means the Pratyagamana will be not the Pratyagamana, actually the Basti material we will not be able to give, especially in case of Niruha, if such things happen with the patients. And the other thing, one more example I would like to share with you is for the Pradhamananasya or the Dvapananasya, where the Churnanasya, the powder nasya, he always used to say, tell the patient to open mouth and breathe when you are going to give the nasya. Otherwise, you will get the nasya, not the patient, because the powder will come back and it will actually go in your mouth instead of in patient's mouth. And the other thing he used to say is, when it is Sarvangadhara, we used to do that with sir, and then he always used to tell us that you will get more sweating than the patient when you are doing the Sarvangadhara, then only it has happened properly. So such uh, active learning was the first benefit I had when in the university age. That lessons, it is never forgotten. What is we learned from the seniors, from the teachers, and I must say, like, please let's go to the next slide. So when you are studying Panchakarma, I'll tell you what my experience was, that you have to be very careful in observing when Panchakarma procedure is happening first, and then when you do it yourself few times, then it goes into your mind. You don't need any book, you don't need any revision when you are supposed to do it for a patient. So you need to remember what is the Purvakama. Like, for example, Nasya is the only therapy where there is Svedana done twice. So if you know that, that means you know the Nasya properly. So you have to do the steam inhalation, and at the same time you have to do the Pottali Svedana on the face. That is the only procedure where the Nasya is the only procedure. Svedana is done twice. Like that, if you remember this very clearly, then it is easy to do the procedure in the authentic way. Next slide, please. So in remembering the methodology of Vasti, Charaka Acharya has said in the Siddhisthana first chapter itself, Tailakta Gatraya. So what we do in some patients, we give Sarvanga Abhyanga and Vashpasvedana. But in certain patients, when it is not required, the Sarvanga Abhyanga, we do the Ekanga, or the at the site of the abdomen and the lower back and the thighs. That much Abhyanga we do, and the Pottali Svedana or the Nadi Svedana we do for the Vasti. Like that, you can slightly modify. And then the next, as I told you, the challenge we face is the duration of the therapy. So what we try to do is, it is mentioned by Chakrapani Datta as well, that it is not wrong that we do the first Anuvasana on the first day, and from the second day we give morning Niruha Vasti, and then after lunch we give the Anuvasana Vasti. So this can sort of uh, give us time to do a Kala Vasti instead of a Yoga Vasti during the 8 day period. So that saves a lot of time, and the patient usually does not face much complications if you arrange the diet properly, that not to give lot of heavy diet after the Anuvasana. Then we usually give boiled vegetables like kind of thing. And soup. Even the Charakacharya says give a mansarapsa, that a meat soup that to hold the strength for the patient. So that sort of thing we do. And when I chose the Yapana Basti, it was because it was minor complications or no complications, and I did not have to worry so much about the Peyadikrama. And then the next thing is it can be even given to a Sukumara person. So in Yapanascha Bhaskara Sarvakaledeya, that is what in any season you can give, any time of the day. So that is why I chose that. Next slide, please. So this is a few more references. I'm sure you all know these references about the Madhutailika or the Yapana Basti. Next slide, please. So this is what I did in my clinical research. You might find a lot of mistakes even, but what I wanted to do is check whether the Vasti is effective or internal oral medication is more effective. So I gave Eranda Bija Shirapaka for 1 month, and exactly half of that, 15 days, I gave Eranda Muladi Yapana Vasti. So milk was added to that. And in the Eranda Bija Shirapaka, Eranda Bija was given to the patient to prepare the Shirapaka, and they took it for 1 month. So in this, this is the, please next slide. So this is the reference, Charaka Siddhisthana 12, I took the Eranda Muladi Yapana Basti, and we modified the recipe a bit, but this is, I found it very effective. And next slide, please. This is what we did. Purva, Pradhana and Paschat Karma. Next slide, please. So in Eranda Bija Shirapaka, Eranda Bija contains something called as resin. So I had to be careful about the ADR. I'm thankful that I did not find in that study the adverse drug reaction, whether there is any kind of toxicity. If there is toxicity, there can be cramps in the abdomen and the person might feel a little bit dizzy. So I was worried whether it would be there, but thank God I did not find those ADRs. The effect of the therapy, as you might well guess, it was the Yapana Basti which was better. Next slide, please. And then this is, I completed my study in 2012. So, and then just last year, I received a call from one of my colleagues. I don't know whether she's here today, Dr. Kundan Gadvi. She was same batch, my Panchakarma group or the class, and she called me up and she said, one patient is asking about you. I got very worried whether I have created a latent toxicity, and then to realize that this patient is one of my research patients who have come after a fall or something, telling that he wants the same Vasti again. And for 10 years, he had no complication, no back pain after that Vasti. I was very happy. I thanked God. And I instructed one of the juniors who are there at Jamnagar now to give that patient the same Vasti, telling all the ingredients. And the patient was happy. And I am happy. Because to receive a feedback 10 years after is a very good thing. So, and next slide, please. I checked the recurrence for only 1 month when I did the study, but God was kind enough to send me a follow-up after 10 years. So, coming to the next slide, we talk about our prescription is never complete without diet recommendation. So, in Sri Lanka, just like in anywhere in the world, the modern medicine, if you ask a modern medical practitioner what to eat after they prescribe you the medicine, they will say eat anything. Even if you have fever, eat anything. So, but when the people come to us, if there is fever, like for example, Langanam. So I always say, if you don't have hunger, don't eat. And when you are eating, you should choose from things which are good for you. So depending on the kind of the disease and the prakriti, I always try to tell them what not to eat. So these are the things which were recommended for the people who were going through the Basti and the Shirapaka. So in Gujarat, if you tell somebody to eat, not to eat Gatia Dokla, they become very depressed. Because these are the most liked food in Gujarat. So it was very difficult to keep them on this diet path. But there are some who are very sattvavan patient um, who actually followed the diet for the time period of taking the Basti at least. And then the amount of water intake is very important, because I have found in the clinical practice, people who are working the workforce of the country, they are not drinking water enough. So that is the very first reason for the all the disease conditions related to the non-communicable lifestyle related diseases. So first thing I try to correct is water intake. So in your clinical practice also, always remember to ask how much of water they drink, how many teas they drink, because tea is diuretic. It removes the water, dehydrates you, and the water and the fruit juices, they hydrate you. So that is an important thing that you need to keep in mind when you are handling the patients. Now, many people ask me how to decide on the diet. Next slide, please. So what I tell them is, there is, look at the color of the food material, because this is one challenge I also faced practicing overseas, because there are certain food items that we don't know. Like for example, seaweed in Japanese people. When somebody asks me how to give the rasaguna vira vipaka karma of the seaweed, then we actually face a dilemma. So I remember Mahadevan sir, he said, if you are a true Ayurveda practitioner, you should be able to tell the properties of Panadol in our own way. So how to say that, because Mahadevan sir is not there anymore, you would not be able to listen to that. So I want to share that, how he describes Panadol. Panadol is Joranashaka, Vedananashaka. That is how Mahadevan sir would say. Okay, so try to turn back the things, turn back the pharmacology of modern medicine and think in our way. And the same way, if you don't know a food item, like for example, seaweed, look at the texture of it, look at the weight of it, look at the color of it. So when I think about the food items, or even the green leafy vegetables and all that, that is what I tell the people. If the color is transparent to blue, you are talking about Akash, Akasha Mahabhuta. And if it is going towards purple to black, it is going towards Vata. So Akash and Vayu taken together is your Vata dosha. So if something like, for example, Began or the brinjals, eggplant, that is purple in color. Look at the inside of it, it is porous, like there are space. So it is definitely Vatavardhan. Like that way, look at the watermelon. So now, if you look at the color only, watermelon outer cover is green, so it goes towards the kapha. The green color is related to the earth, so it is going towards kapha. And then if you look at the texture of it, it is very watery. So even though the inner color is red, it is not going towards the pitta, because the water component is more, it is more going towards kapha. So it is shitavira. Like that, if you keep on thinking in terms of color, now I told you about the vata color, and then if it is pitta, it has to start from the range of yellow and go till red. So all the shades of that are pitta. And then if you look at the kapha, the earth color, the brown, to the green color and white. These are the three things which you have to remember in case of kapha. Why I say so? When you are deciding the prakriti, if somebody green-eyed person, green texture of the iris is there, definitely that part is going towards high amount of kapha. Okay, so color of the eye, blue eyes, again vata predominant. Red eye, the dark brownish color, is going towards the pitta. So red hair people is going towards pitta. Like that, when you can just looking at the person, you can decide the prakriti. Same way, looking at the food item, you can decide on the vata prakopaka, pitta prakopaka, or the kapha prakopaka nature of the food. So then you can effectively write a diet list. So this is the exercise plan. Today happens to be the International Yoga Day. So these exercises, half of them, the next slide please, were taken from yoga. And I wish you all a happy International Yoga Day. And I happen to be not a very strong practitioner, but because I believe that yoga is not gymnastics, as many people try to and tend to do in Sri Lanka. And there are different varieties of yoga which I do not comment upon. And when it comes to yoga, it is a spiritual path. So the meditation path and the pranayama part is very, very effective if you practice effectively. And don't tell others about your practice. Because in yoga, it is very much said that it has to be hidden, kept safe within you as a secret, what you practice in yoga. And asana, that is taken as gymnastics, so very much taken to be a part of fashion. That is not the case. Asana is the concentration that you need to achieve in meditation. So the next step would be the meditation. For that, controlling your body, controlling your mind, that is very important. That is why the yoga asana is given, not for practicing gymnastics. That is my strong belief. Next slide, please. Next one. So these were the lifestyle modifications. Next slide, please. So what did I learn in India? A wealth of knowledge and the clear, true practice of Panchakarma. And I'm very happy to say from MS Baghel sir, Anup Thakur sir, Mahadevan sir, I met amazing gurus. And of course, the younger generation, Rajkala madam was there, and then Rajgopal sir, then there was Mandeep madam who was teaching us. All these gurus were amazing. And then the most important thing I saw was sharing the clinical experience. So if we are in the OPD or if we are in the IPD, always Rajkala madam also used to tell us, and Baghel sir also, that do it with your own hand, get the practice. That is when you become daksha. Daksha is the dexterity, your practice of it. Anytime, because when I started practicing, I had to train the therapist. So if you don't know that, how to give a basti, if you don't know how to do Sarvangadhara, Shirodhara, Nasyam, then you cannot train somebody else. So as students, your practice should be so thorough or detailed and repeated until you can train another person. And it was and you are so lucky to be born and learn in India, because there is a huge amount of books available on each subject. And my nicest memory is the hospitality and sharing of knowledge and culture in India. And I'm so grateful to India for making me the person, the confidence that I have because of that knowledge. So thank you very much for having me today. And I'm very, very grateful to Rajkala madam for giving me this opportunity to tell how grateful I am for the knowledge that I reached or achieved in India. Thank you, madam.
Thank you, Damayanthie, for such an enlightened lecture. It was really our students like it, they enjoy it, and there were many practical things you got from different parts of India. You are practicing there, and you are giving back to India. It is really a pleasure that whatever you got from India, you took it to the Sri Lanka, and you are giving back it to the India. Okay, very nice. Thank you, Dr. Damayanthie. Our students are very happy with the way you describe the complications of Basti, how to manage that, what are the diet modification to be done, how to plan the diet for the patients. It was really wonderful. And of course, like we came to know about what is the present practices of Panchakarma in Sri Lanka. So on behalf of the Department of Panchakarma, Faculty of Ayurveda, IMS BHU, I thank you for delivering such a great lecture for our students, and of course for me also, it was a very nice experience to hear you after many years. And I could remind, I was discussing with the student, yes, and Dr. Damayanthie reminding me that before 15 years also I was the same. Now also I am insisting the students that, yeah, they can put it in the chat box. There are some questions. No. And
Hello.
of course,
Hello.
Yeah.
Speak.
Yes, sir.
Dr. Damayanthie very nicely presented the subject, very clear, and she highlighted the problems while encountering with patients, how to convince our, especially about Basti also, she described about that. It was very true. The main problem is convincing the patient. That is the strength of the physician also. And one thing I want to ask about Nasya, when you told the only treatment where 2 times Vedana is given. Just explain that.
Yes, sir. Thank you very much for the question. In the Nasya, in the Purva Karma itself, after applying the oil on the face, head, and the neck area, we first do the steam inhalation by medicated steam. You can put some herbs in the water and then prepare the steam and make the patient to inhale the steam, and then we make the patient to lie down in the position for the nasya, and then because we want to increase the blood circulation to the cheek area and the forehead, we prepare a small pottalia, and with that small pottali we do the svedana. After that only we instill the drops, or whether we are doing the churna nasya, then the churna to the nostrils. So then it is said that our teacher I.T.R.A sir would always say that the second Svedana is also very important, because that will increase the blood circulation and it will facilitate the absorption of the medicine properly. So that to avoid the any complications or the Vyapat, it is important to remember the second Svedana also should be done.
Okay, thank you. Clear.
Thank you, Silla.
Yeah, Dr. Damayanthie, you might be not knowing that Dr. Vinod Kumar ji sir is the former professor and head of the Department of the Panchakarma, Government Ayurveda College, Trivandrum, and I am the student of it.
Really? Oh, I'm
Yes.
so humbled, sir. Thank you very much for asking that question. I'm very, very happy that you asked that question, and to have you here, sir. I'm very happy. Thank you.
Thank you. Thank you. Again, I congratulate Dr. Ajkela for continuing this very good program.
Thank you, sir. Thank you, sir. It's all your blessing, sir. I could do it. Dr. Damayanthie, there is one question by Dr. Kishore Mahendran. Can you share the Ravana Samhita in Tamil text PDF or book? Ravana
Sir, I
Samhita.
will Ravana Samhita on astrology. I will try to find you a PDF version, sir. I found it in the India also in the certain Ayurvedic medical bookshops. If I find you, please give me your contact details, sir. I will definitely give it to you.
And Dr. Damayanthie, there is one message from my teacher who taught me the Panchakarma in my BMS graduation, Dr. Pradeep Madnai from Sangli, our clinics. He has written like, it is an interesting to know the scenario of Ayurvedic medical status in Sri Lanka. Best wishes to enthusiastic and knowledgeable Dr.
Thank you very much, sir. Thank you very much, madam.
So he is only the first person who introduced the Panchakarma to me. Like in my BMS days, final year and internship, I could practice the Uttarabasti, Vamana, Virechana under his guidance and Dr. Mamta Madnaik madam's guidance.
So thank you so much, sir, for creating such a good teacher for us.
Yes, of course, it's all because of my teachers. Yeah.
Yes.
Yeah, so thank you, Dr. Damayanthie. I think there are no more questions. It was very clear presentation for all of us. And I really thank my teachers, all the teachers and all the participants or students who joined online and making this event successful. And it's a we all wish that Panchakarma should have the evidences that nobody could mispractice the Panchakarma in India or in the world, that there we should
Yes.
is that there is the evidences that practitioners, that was the actually theme why we started this online guest lecture, that there are many good practitioners of Panchakarma who are doing authentic Panchakarma. So that was the idea behind that, and of course it is very useful for our students and those who joined online also, who are joining online also. So thank you all for making this online guest lecture series a success on behalf of Department of Panchakarma, BHU, and thank you all. Namaste to all. Yeah. Thank you, Damayanthie.
Okay.